Okay, so you had an injury when this...
Right,
Gotcha.
that is correct.
So I'm Dr. David Franklin. I'm a podiatrist with Blount Memorial Physicians Group.
It has been bothering me about 3 good solid weeks.
We are ambulatory beings. We've been given 2 feet, and that's what gets us around. And so when something is messed up with the foot, it makes just doing your day-to-day activities more difficult.
Swells and tender.
Your feet are your foundation to your body, and if your feet hurt or if they're out of alignment, that can get your whole body out of alignment.
It's like on fire.
Podiatry is kind of a weird specialty, so I see anything with the foot and ankle. Could be trauma, could be a dermatitis, a rash, those type things, or could be chronic deformities, and I also treat a lot of foot infections and pathologies associated with diabetes.
From that trauma, it kind of broke some of it off.
Sure.
Injuries, tears, ruptures, broken bones.
One of the more common things that we'll see is heel pain or plantar fasciitis, and so that's treated with essentially physical therapeutic techniques, supportive shoe inserts. There comes pinch. Sometimes we'll use steroid medications injected, sometimes we'll use oral anti-inflammatories, but most of that is really patient education and patient driven. I'd say one of the most common things we see now is overuse type pathologies, and I think a lot of that is associated with poor shoe gear choices for the activity you're doing. You know, I see people shooting basketball and things in sandals, or, you know, walking at Dollywood and, you know, in thong flip-flops. And so being aware of what activity you're doing and what shoe gear is the best to do that in, I think, is an important thing. And then if we look towards our diabetic population, they just never check their feet enough, you know, and so by the time they get to us, lots of times things have gone a long way down that road.
Helping people to feel better and be active and healthy is satisfying.
Let me get you to push down for me. So that's one of the reasons probably I chose podiatry. It is fairly gratifying. There's rarely a time someone comes in that they have a problem that we can't do something about that has them leaving in a more positive state than they came in. And so that's very rewarding as a provider to get to see relief, or sometimes it's just a matter of educating someone to a point that they have an understanding of their pathology and therefore they leave with less anxiety than they came in with.